Hi, welcome everybody. It's me, Dr. Khaled Sadek, and you tuned in for another episode of my global virtual clinic. Welcome everybody. If you're new to the channel, welcome. I'm Dr. Khaled Sadek, your host for this evening, and I've dedicated my YouTube channel entirely for the treatment of cysts and lipomas. So if you are looking for treatment for any cyst or lipoma, then you've come to the right place. Drop me an email at lipomacyst.com. That's your one-stop shop for all skin complaints. Remember, you can also find me on Instagram, Facebook, and Twitter, as well as drkhaledsadek.com. Today, we take a global virtual clinic, which we run every Wednesdays, Fridays, and Sunday at the same time, 9:30 Greenwich Mean Time. That equates to about 4:30 Eastern Time, 1:30 Pacific Time, and about 6:30 in the morning in Australia, if you're tuning in from Oz. So, for those familiar with the format, we take questions from the audience, any medical conditions that they wish to discuss. I'm happy to discuss those with you. So please have your questions ready, type them in the comment section, and we'll scroll through while we're giving a shout out to everybody. We'll answer questions as we go. We also like to take this opportunity to discuss the videos that we've released and about to release. So the last couple of days, we've released a couple of Scaramanga type videos, a number of cysts, and a compilation video of blackheads, some favorite pops there for you to enjoy. In the next clip, we've got a very awkward sebaceous cyst. Awkward in the sense that it's actually in the abdominal area. It's right next to the belly button. Quite an unusual place to get a deep epidermoid cyst. And it's quite large, so be prepared. So that's coming up. We've also got some wonderful pops coming on Friday and Sunday, so stay tuned for those as well. And we'll probably be dropping a compilation video of your favorite pops. So let me know what you enjoy watching and we'll put them online. So let's go to the audience. This is it, the moment of truth. Let's see what questions the audience have for me tonight. So we'll go straight to the top, scroll right to the very top. And we do, as we do every evening, we do the podium positions. That's those of you who have been allocated. Marion, well done. She's wishing everybody to stay safe and well, and she's got the #1 podium spot this evening. In at number 2, we've got from Virginia, we've got our dear friend Sherry. Sherry, congratulations from Virginia. You've got in at number 2. And in at number 3, our dear friend from Arizona, Bridget Schumacher. Well done you three for getting on top. Just missed the podium, Christiana. Sorry, snooze you lose in this game. 4th place. Sherry is saying, how exciting! My 2 favorite VC people take up the top 3 spots with me. Fantastic. It's fantastic. I love the abbreviation VC, Virtual Clinic. Yeah. Well, that's what it is. It's a virtual clinic. I'm Dr. Khaled Sadek, your host for this evening. As you know, we sometimes have a round table of other specialists. We've had our resident orthodontic dental surgeon, Dr. Sarah. We've had our resident neuroradiologist, Dr. Sina. He came and did a round table chat on a host of questions, from phobias for having MRIs to what to find on scans in diseases. So if you haven't seen that video, check out the roundtable live discussion with myself, Dr. Sarah, and Dr. Sina. Let's see who else is in the house. Sid G. Hello. Wonderfully sunny in Ontario, Canada. And she's wishing everybody a wonderful evening. That's very nice. Mary Ann from Buffalo. She is saying it's pretty hot in Buffalo, but she's wishing everybody well. Lovely. I love the love going around this evening. Dr. Sarah is saying hi. So remember, if you've got any questions for her, make sure you ask in the comment section. Remember, feel free to also check out her videos. She's got a lot of dental hacks, Facebook and Instagram. From Chicago, we've got DDK. Welcome, Chi-Town, Chicago. I'm painting Christmas ornaments. That's Sherry. Hope I don't have paint on my green phone. I hope not. Be careful. Sid G, my mask hasn't arrived yet. Well, look, my mask has arrived, so I thought I would show you what the blue and white stripe one looks like. It's not bad actually. The fabric's pretty decent. I know a lot of you have got your masks. I know Bridget wore her mask for her appointment to see the doctor. That was wonderful. And I think she's got, and it's got like Dr. Sadek at the bottom there. I think it's quite nice, very pleasant. I might even do the entire consultation like this. No. So if you want your merchandise, Teespring is the place to go. Remember, all proceeds go to cancer research. So Prince of Zam, greetings from Snaresbrook. Wonderful. Prince of Zam, he's the man behind the cam at East London cameraman and more. Gail Sharp, good afternoon. Lisa Gianteco from Northern Carolina, welcome, welcome. Prince of Zam, he's disappointed. He was 1 minute off a podium position. 1 minute's a lot in this game. People do not waste time. Patty from Mississippi, welcome Patty. Good to see you again. Sulalali, welcome. She's enjoying the program from London and wishing everybody a very safe evening. Hope everybody's Wednesday's going well. Let me know how your Wednesdays have been going. We've been busy in clinic doing lots of pops, and so we've got a lot of material, or just deciding what to send you and how to dress it up. So we've got a lot of material. Let me know what you want to watch. I really want to do some more compilation videos, so let me know your favorite pops and we'll put them in there. Okay. Rose Hubbard from Alaska, and it's 12:30 Alaskan time. That's brilliant. I need to remember that. Alaska is 12:30. Wonderful. Joyce Bauer. Hello, everybody. It's a wonderful day from Cleveland. Wonderful, wonderful, wonderful. And Marco from Hungary. Wow, what time is it in Hungary? Let me know. That's we don't normally get people from Hungary. That's a first. Welcome, 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 Mary. It's wonderful to have you. Wonderful to have you. My question is, why is the chimney in your yacht red? That's from Prince of Zam. Why is the chimney red? He's absolutely right. I don't know if you can see it, but the funnels, I think he means the funnels. The funnels are red. And a red funnel is a signature piece for one of the large cruise liners, the Cunard cruise liner ships. Their signature is the red funnel. Not to be mistaken, of course, with the red funnel ferry that goes from Southampton to the Isle of Wight. That's a completely different story. So the red funnel, signature piece for some of England's cruise liners. Denise Bonkey says, hi from Edmond in Washington. Wow, great United States representation. From the Netherlands, from Holland, we've got Mary Wolf. Wonderful, Mary. Where in the Netherlands are you? Tell me, please. Peggy Yates from Michigan, United States of America. Welcome, Peggy. What's the weather like in Michigan? What have you been doing today? Let me know. Tracy McGarth is from Boston with an itchy head to the toes with a rash, and it's maddening. Take some, maybe it's a hay fever, maybe some antihistamines. That was Tracy from Massachusetts, Boston. Home, of course, to Harvard Medical School. Minnie, how are you doing, Minnie? Minnie Carey from Alabama. Welcome. She's sending her love and greetings to everybody. Helen Cole, what time is it in the United Kingdom? At the moment, it's 9:30 p.m. because it's 9:30 GMT time. Who we got here? Margaret Brace. Is it comforting the way you connect with us throughout the world? Yeah, I think so. I think it's wonderful that we're able to do a virtual clinic and that we have it on a regular time, and people from all over the world can listen in live, or they can watch the reruns. It's really great when we have really interesting questions. We've had a lot of questions about COVID-19, vaccinations, the antibody tests, the hand washing, the shielding, COVID-19 and pregnancy, and we've done videos on all of those topics. So if you want to get up to date with your COVID knowledge, then you can check out those videos. We've also done topics on a whole host of things, from diabetes to shingles to cold sores. What else have we done? Loads, so many discussions. So it's a wonderful platform for, one, disseminating medical education, two, for connecting with all of the movement around this particular genre of videos, as well as telling people about the material that we've released, discussing it, a bit of the editorial discussion, as well as telling you some of the videos that we've got in the future. While you're watching, it really helps me and the channel if you hit the like button up there, because that way Google knows that we're alive and we're watching, and it helps to push up the video. Makes our people who have already liked, thank you so much, but continue. Let's push up to 50. Who else are we having? We've got Marty in the Moreno Valley in California. It's 108 degrees. I heard that Death Valley, he reached 130. That's sort of 54 degrees centigrade in Inferno Creek. What is going on? Those temperatures are mind-blowing. So 108 is very, very hot. Maureen P from Buffalo in New York. Wonderful. I love Buffalo. Right on the border with Canada and Niagara Falls. I loved it there. Trender, you're so good at being a great doctor. Trender, so kind of you to say. So kind. Thank you so much for your support. Where are you calling from, Trender? Let me know. Olivia Webster from Jamaica. Wow. What's the weather like in Jamaica? You must be having a wonderful time. Shirley Ann Young, hi from Prestopans. And it's a sunny day. Welcome, Shirley Ann Young. Welcome. Help with migraines without meds. Weather change. That's Bridget Schumacher. So migraines. Let's talk about migraines. So migraines, for those of you who suffer from them, are headaches that will come on intermittently, will last for a few days, and they may be associated with other symptoms. Sort of, photophobia, not wanting to be around bright lights, very sensitive smell, nausea, very much feeling down in the boots, really, not a wonderful experience to have. The spectrum for treatment of migraines stretches from, pressure points, just kind of doing pressure points at the back of the head, to the pharmacological aspect where I kind of step in. And the first step on the migraine sort of analgesic ladder, that pain relief ladder, is you go in with simple paracetamol and ibuprofen. So paracetamol with some non-steroidal anti-inflammatories. So that's your first kind of step. And a lot of over the medications in Walmart, Walgreens, Boots, wherever you are in the chemist, like Migrelieve, are a combination of paracetamol and ibuprofen. A step up from that is obviously the prescription medication, and you're looking really at the first rung is something called a beta blocker. A beta blocker. And it used to be used for blood pressure, and it basically helps to dilate blood vessels, improve blood flow. So the first rung is the beta blocker, and it's really a pill in the pocket. You don't need to take it every day. You just take it when the symptoms come on. So that's the first rung, having taken the ibuprofen and paracetamol. The next step up, you're looking at the triptans, which is like sumatriptan. And those are sort of tablets you take sort of once a week. Yeah. A step up from that, you're probably looking at neurological opinion, and they've got other medications, and sometimes they use epilepsy drugs, sometimes they use pregabalin, amitriptyline, and there's lots of different other medications in that space if we're resistant to those three first lines of migraine. So I hope that's useful. Bridget, thank you for asking about migraines. Janita Pickett, welcome. Are there any fruit and vegetables I should be avoiding being diabetic? Well, let's talk about diabetes. Why not? Let's talk about diabetes. So as we know, diabetes is a global epidemic of diabetes, and it's really because modern consumption of food involves refined sugar and vast quantities of it, and we live relatively sedentary lives. So you're getting this constant sugar, and it's putting a lot of pressure on the pancreas. And the pancreas is the organ that helps to kind of mop up this sugar from the blood and put it into stores like muscle or burn it. And it does that using insulin. Now, if you put too much pressure on the pancreas, it's unable to produce that insulin to mop up the blood of sugar. And what you get is the blood sugar level rise. And that's where you get diabetes. And so the problem of having this infinite rise of blood sugar is that it actually damages systems in the body. It can fry your nerves. So you get neuropathies. It can damage your eyes. You get diabetic retinopathy. It can damage your kidneys and give you nephropathy. It can also have a vasculopathy. So it basically fries the blood vessels in the distal limbs. So you get like your toes go gangrenous. So high blood sugar levels basically is a toxin for many, many systems in the body. So for that is basically a reference point and tells us the average blood sugar levels in the past 3 months. And if you get 2 consecutive levels over 48, in the United Kingdom, that's millimoles per hemoglobin of the units, then you're classed as diabetic. And if you're between 42 and 48, you're pre-diabetic. Now, the mainstay treatment is lifestyle. So that means diet and weight loss. Now, if you lose 10, 20 kilos, you might be able to reverse the effects of diabetes. You might put diabetes into remission. So just by losing weight, you can actually cure your diabetes. Although, to be honest, once you get diabetes, you're never cured of it. You just go into remission. And there's always a risk of you going to relapse. Failing that, the next step is metformin. Now, metformin is a wonderful drug. There's a great story behind metformin. It's actually a plant-based extract, and it was used ages and ages and ages ago, 4,000 or 5,000 years ago, by the ancient pharaohs to treat what they were describing as sugar in the urine, glycosuria. And they found that the plant from which metformin is extracted from helps to reduce that. And we use it to this very day. And metformin is the chemical compound equivalent of the plant extract. And metformin basically works by helping to absorb some of that sugar in the blood back into the systems. So it helps to drop your HbA1c, reduce the pressure on end organs. It also, you won't believe this, but in mice studies, it's also been shown to make non-diabetic mice live longer. How about that? It's a drug that can make you live longer. So if you're into biohacking and longevity, metformin is one of the drugs that people really want to go on. You know, the only problem is if you take too much metformin, it'll shrink your lifespan. So there's a window of opportunity at which point metformin will have that longevity effect. It can also burn calories and cause weight loss. So yeah, metformin's a wonder drug. But in terms of your question, what fruit and veg to avoid? Well, if you're diabetic, you're invariably given a blood glucose monitor, and so you must measure your blood sugars. You must also titrate your insulin medication accordingly. And so one of the techniques you can use is a product, the more sugar it has. So if you're drinking apple juice, grape juice, fruit juice, then it's going to be high in sugar content, as opposed to if you're drinking sort of just water. So just bear that in mind. So there's a little bit of background on diabetes. It's good. It's a big topic. So much to cover in diabetes because it's massive. It affects multiple organs. It affects your blood pressure. It's one of the metabolic diseases. And if you get diabetes, you're likely to get obesity and cardiovascular disease and stroke as well. There's so much about diabetes. In fact, we can do a whole video on diabetes. If you want a video on diabetes, we'll do one. Okay, let's see who else is in the house. Julie Hurrell, how are you doing? Hello, Julie. Welcome, welcome. Sula Lally, I need help, please. That's for Dr. Sarah. She's lost her filling, but as COVID-19, she's unable to find a dentist. Please advise. And that is a story I hear time and time again. Hopefully we get an answer for that. Lisa Joan Turco, it seems the video started on Sunday before you finished the clinic. Should we shift the video to 5 p.m. Eastern time if we wish to see it when it actually premieres? It should have come out 9:30 Greenwich Mean Time. So just double check what it equates to in your time zone, because obviously the times may change. You may have your own sort of summertime shifts. So the Greenwich Mean Time is the gold standard. So please adjust your clocks to 9:30 Greenwich Mean Time, 9:30 p.m. Greenwich Mean Time. So just Google it. What is 9 p.m. Greenwich Mean Time in my time zone? And that'll tell you what it is. So if I stay at 9:30, then everyone else should be doing it exactly the same time. Prince Azam is loving the roundtable discussion. What he doesn't know is that he will be invited very, very shortly. Dottie from North Carolina, welcome, Dottie. Belinda from Cologne, how are you doing? The massive pilar cyst. Yes, so the massive pilar cyst, I looked at the footage for the massive pilar cyst, and it's quite full on. there's a lot of stuff that comes out. It's really graphic, and I really kind of hesitating about releasing it because it's so graphic. But let me know your thoughts. Should we release it? Should we not release it? Should we release it to a limited number of people? It's massive, and it comes out massive. It keeps coming wonderfully well, and he's keen to see it as well. But I'm just sure. Let me know. Maybe we'll do it on Sunday. Maybe we'll do it on Sunday. Marion, 9:30. How are you doing? Enid Shaw from West Mancunian. Welcome, welcome. I just have some good news to share. I'm 41, starting college in January for the first time, and she's going to be a social worker. That's DDK. Well, congratulations. Rosie, I have a question. I've had a number of procedures on my back, and I've noticed a few lumps in the area of the incision. Is this something I should have looked at? Absolutely, Rose. Have that looked at. I'm not sure what it could be. Could be scar tissue. It could be regrowth. Absolutely, get that checked out. Mary Wolf, do you believe face masks really protect against COVID-19? Do I think they protect against COVID-19? The data would suggest that they do. Yeah. I certainly wear them in clinic because if someone sneezes in my face, then I have a barrier, or if I have it, then I'm unlikely to kind of get that aerosol to spread further than the 2 meters. So I think they certainly play a role. I know a lot of you are saying, you know, COVID-19, the particles are really small, they're going to go through the mask, it's not going to protect us. But the data shows that if you slow the aerosol down, it actually doesn't spread that far. So certainly it is a simple way of slowing down the R number. That's the reproduction number in the community. That combined with social distancing, hand washing, and all the other additional issues that go around that. Laura, how are you doing? She's from Kentucky, loving everybody. Wonderful. There's enough hate in the world, and she's loving everybody. That's awesome. Welcome from Brazil. Arani from Brazil, welcome. Anna Marco, welcome. Sid G, question for Dr. Sarah. Okay, we'll leave that for Dr. Sarah. Jean Mullins, hi from South Africa. Welcome, welcome. She's got a question for Dr. Sarah as well. Sandra Goody, hi from Enfield. Welcome. It's been rainy today. Can you send me your scrubs you're wearing? I want them so badly. Well, if I send you my scrub, what am I going to wear? You know what? We will somehow release these scrubs as well. I'm not signed Dr. Khaled Sadek scrubs. They're really cool, actually. I do like them. I like the color. So Keely Doll, Dr. Sarah, Dr. Sadek, just getting ready to be released from hospital from surgery. Keely Doll, hope you're recovering well. Hope that your hip surgery is doing wonderfully, wonderfully well. Joyce Suggs, how are you doing? Mrs. Harland, how are you doing? Terminator, welcome. Sandra Carwood from Maryland, welcome. I have a question, says Marion. I have a small pinhead bruise on my skin. Could it be caused by fragment? Yeah, potentially. If you're on it, if you're on a low molecular weight heparin, certainly you may have some sort of petechiae bruising. Margaret Brace, did you get the map United States with the state names and the abbreviation? No, I haven't yet, but I will. It's on my to-do list. Green River House from Seattle, welcome. Jean Stanley from Oklahoma, 31 degrees. Marty, how are you doing? She's got, how do lipomas form? Lipomas are benign fatty growths. You know what? That's a good question. I have discussed it in one of the videos. So I have a video on lipomas and how they form. But in a nutshell, we don't know. Is the long and short of it. But trauma, family history certainly can play a part. Sandra Goody, I suffer from migraines badly, especially when I'm stressed out. Well, I hope these videos help to de-stress you. North Carolina, Deborah. Linda Gaskill from Oklahoma. I have extreme migraines. That's Sherry. I hope the information is helping. Gail Marie Reynolds, good afternoon from South Jersey. Welcome. Let's have a look. Arani from Brazil, loving the show. Linda Gaskill, wonderful. Sandra Kaywood, welcome. She wants to know, how do you get rid of milia, white spots? Ooh, probably the best thing to do is to get the hyphicator or the laser. That's what I would recommend. Deborah, I lost 135 pounds and don't have diabetes anymore. Whoa! Round of applause, Deborah. That is a winner. From Enfield, paracetamol, ibuprofen don't work. Yeah, migraine relief doesn't work too well. So you have to hit the harder stuff. Kathy Hall, do you get opportunities to do steatocytomas? We do, but we don't see them so often. Question from Sid G, does fatty liver go away? Yes, it does. Fatty liver is reversible. Lose weight, your liver will lose weight. Linda Gaskill, impressed. Irani, welcome. Laura Wallace, wonderful doctor. Have you heard of something that looks like it? Don't do that. North Carolina, Sharon, how are you doing? Patricia Williams from Texas. Oh, so many people. Laurie Wallace, welcome. Robbie North from Central Carolina. Sharon Lester, Kathy Hall, Lisa, Linda Gaskill, Gail Sharp, Marion, how are you doing? Denise, how are you doing? So many people. Janita, so many people. Sorry, I couldn't get to every single one of you, but thank you so much for watching. I don't want to delay because I want to get to the premiere because we've got a wonderful video to watch. So today's Wednesday. I'll catch you again on Friday. We've got a wonderful clip on Friday and Sunday. Till next time, everybody, stay safe. Ciao. Bye-bye.